Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I'm a U.S. Army veteran, physician assistant, and former compensation and pension examiner. Today, I wanted to come on and discuss what happens in a compensation and pension or CMP exam for prostate cancer. So we've done several videos about what happens in a CMP exam, and I've gotten a lot of positive feedback that it can be very helpful to veterans because they get very nervous and are very apprehensive about their CMP exams. So sort of shining a light on what some of those questions might be that will happen in the exams, or what can happen, can be sort of helpful to ease some of those fears. So let's just jump right into it. So the first thing that's going to happen is you're going to get if you get scheduled for the exam, is they're going to send you a packet in the mail. It's going to say who the provider is. They're usually going to call you as well, but you'll get a packet in the mail. It'll tell you who the doctor, nurse practitioner, or PA is that's going to be doing your evaluation, where it is, and what time it's at. So it usually will tell you how long the person's been a CMP examiner and what their qualifications are, like what type of physician they are, if they're a urologist, or if they're an internal medicine doctor or family practice, or whatever it is. Okay. So once you show up to the exam, they should go over what's called the Disability Benefit Questionnaire with you. And the DBQ is short for DBQ. DBQ is short for Disability Benefit Questionnaire. You can find on va.gov. You can also ask your treating provider to fill this out if they're willing to do it, and you can utilize that if you find that helpful. So this particular DBQ has several other conditions on it as well, and they might not be applicable to your case. A lot of the DBQs are used for more than one type of condition. They sort of group them so that the form can be used for different things, right? And so we'll go over some of that here in a second. So I'm going to go ahead and pull this up and share it with you guys. Just 1 second. Okay, so this is let me jump back up to the top here. This is the DBQ for male reproductive organ conditions, including prostate cancer. Okay, let me see if I can get it to be just a little bit bigger. Okay, there we go. So as you can see, the top here is going to be the name of the veteran, your social security number. This is for the examiner to fill out. Obviously, this portion here is, are you completing this DBQ at the request of the veteran claimant or somebody else? Are you a VA healthcare provider? Yes or no? Is the veteran regularly seen as a patient in your clinic? If not, how was the exam conducted? Okay, so that's just some information for how the doctor knows you, or, how was the exam conducted? Was it on a telehealth exam? Was it virtually on the phone? How did they see you? Did they see you in person? So evidence reviewed. So here's where they're expected to write the evidence that they reviewed. So it could be your claims file. It could be a few records. It could be whatever you've provided to them. It could be personal statements, buddy letters, your VA treatment records, your private doctor's records, your service treatment records, a whole host of things. Okay. The diagnosis. So here you can see it says, does the veteran now have, or has he ever been diagnosed with any of the conditions of the male reproductive system? Yes or no. So if it's a no, the form's probably going to stop pretty much shortly after this. So if it's a yes, they're going to check all that apply. So you might have multiple conditions. For example, if you had prostate cancer, you might also have erectile dysfunction related to that that's been diagnosed. So they might check that. They might check that you've got here neoplasms of the male reproductive system, including prostate cancer, or any of these other conditions. All right. And then there's a block for other. If you've got other issues going on, they're supposed to write that in there. And if there's any additional diagnosis that pertain, they can write it in down here as well. So the next section is the medical history. So they want them to describe your history, like when did it start? What happened? Were you diagnosed on active duty? Did this happen many years later? So describe the history, including onset and course of the veteran's male reproductive organ condition, including prostate cancer. Brief summary. Does the veteran's treatment plan include taking continuous medications? Yes or no? And then they want those medications listed. Have you had an orchiectomy? Yes or no? Indicate, so an orchiectomy or testicular removal, yes or no, left, right, or both. Maybe the person had testicular cancer and prostate cancer. So that might apply. Indicate the reason for removal. So again, we're going to just assume that this is a no, because we're just going to mostly talk about prostate cancer right now. So if it's a no, then the rest of this little portion doesn't get filled out, okay? Is there any renal dysfunction due to any of the conditions? We're going to assume no. But if it's a yes, they want you to go to the renal conditions DBQ. They should fill out a subsequent DBQ. Does the voiding dysfunction? Does the veteran have a voiding dysfunction? We're going to assume that this is a no. But if it's a yes, then they're going to go through a whole bunch of questions about, do you have to wear absorbent materials? How often do you have to change them? And different information about the voiding dysfunction itself, urinary frequency, and sometimes this can be a big residual. So if it's a yes, they're going to ask you these questions. Do you wake up at night? Do you have daytime? How often is the interval between the voiding episodes? Between how often you have to go to the bathroom? Do you go to the bathroom every 2 hours? Do you go to the bathroom every hour? Do you have symptoms of obstructed voiding, hesitancy, slow stream? If it's a no, again, this is not going to apply. If it's a yes, whichever of these things apply is important to note. Erectile dysfunction. I have a great video on erectile dysfunction, what happens at a compensation and pension exam for ED. So if you feel that's relevant, you might want to go check that one out. But the key thing about erectile dysfunction is that, well, we'll get down to that in the physical exam portion. Okay. Retrograde ejaculation. If it's a yes, they want them to describe the etiology, like what is the cause of that? Is it related to the prostate cancer or something else? Male reproductive organ infections, including UTIs. We're going to skip this portion because we're not talking about UTIs today. We're just talking about prostate cancer. But if for some reason you've got recurrent UTIs that your doctor feels is related, that might be important for them to note here as well. So now the physical exam portion. Okay, so this is what I was going to say about the ED portion. So whether it's for prostate, for ED, for whatever, you can decline the exam. Right. So a lot of people get really nervous about this. And so when I was an examiner, especially I did a ton of exams, erectile dysfunction is a very commonly claimed condition. And most gentlemen, it was very uncomfortable for them, for a healthcare provider, like it's normal. We do these types of exams all the time. But you can just report, hey, my anatomy is normal, if that's what you so choose. So you see here, there's a block on the examination of the penis. Is it normal? Not examined per veteran's request. Not examined per veteran's request. Veteran reports normal anatomy with no penile deformity or abnormality. Not examined, it's not relevant to the condition, or abnormal if the person looks at it, and then they're supposed to put why is it abnormal? Okay. Testicles, same information here. Did they examine it? You can decline to have it examined or to have them examined. Epididymis, same thing. You can decline to have that examined, or they can examine it and put their remarks. Prostate, same thing. Normal, not examined per veteran's request. Not examined, not medically advisable for reasons including but not limited to recent prostate surgery, recent seed implants, anal stricture, fissures, anal pain, anal surgery, thrombosed hemorrhoids, acute inflammation, prostatitis, and or other reasons. So if one of those reasons apply, it might not be indicated or advisable for them to examine you. Or you can just say no, like I don't want to have it examined, right? Tumors or neoplasm. So this is going to be sort of the portion that's kind of relevant to cancer, right? So does the veteran currently have or has had a benign or malignant neoplasm or metastasis related to any condition in the diagnosed section? So this is probably going to be a yes, right? If you've had prostate cancer. Is the neoplasm benign or malignant? So we're talking about prostate cancer, so it'd be malignant. And so they're going to want to know, is it actively going on? Is it in remission? Is it a primary prostate cancer, or is it a metastatic cancer? Like, did you have some other type of cancer that metastasized? Did you have lung cancer that metastasized to the prostate? Has the veteran completed treatment, or is the veteran currently undergoing treatment for a benign or malignant neoplasm or metastasis? Yes or no, you're doing watchful waiting. And then they want information about the surgery if you've had it. Did you have a prostatectomy? Did you have a TURP? Did you have radiation, chemo? All of these different things, they want to know the information about it. When did it happen, or when is your treatment going to be finished? You might be going through radiation and have several treatments. You might be in the middle of it. Does the veteran currently have any residuals or complications due to the neoplasm or its treatment other than those already documented or reported above? If there are additional benign or malignant neoplasms or metastases related to any of the diagnosis in the diagnosis section, described using the above format. Other pertinent physical findings. This is sort of a catch-all. Diagnostic test. Oh, scars. There's always a question about scars on pretty much every DBQ. Scars are disfigurement of the skin. So they want to know, like, if you had some kind of surgery or procedure and you've got a scar, yes or no, then they're supposed to fill out the scar DBQ, because you might get some compensation for that as well, potentially. Diagnostic testing. Have you had a biopsy? What are the results if you did? Are there any other significant diagnostic tests or results related? Functional impact. Regardless of the veteran's current employment status, do the conditions listed in the diagnosis section impact his or her ability to perform any type of occupational task like walking, lifting, sitting, etc.? Remarks. This is just a catch-all remarks section for them to write any comments. And then they're supposed to endorse it, sign it, put their information, all that kind of stuff. Okay, so let me take the screen share down here. Okay, so I hope this was helpful for you guys to get a better understanding of prostate cancer CMP exam. We'll do some more videos here coming up. I think I'm going to do one about prostate cancer in Camp Lejeune pretty soon. So I hope this was helpful. Please drop some comments, guys. And as always, thank you for watching.